2 of Re-Summit 2047, Resilience and Sustainability Summit Vision 2047 on Science, Policy, Planning, Practice, Interface for DRR and Changing Climate, which is being organized by the National Institute of Disaster Management, NIDM, in collaboration with Department of Science and Technology, Government of India, and in partnership with United Nations Development Programme, UNDP, and GIZ India, which is being organized in consonance with Azadi Ka Amrit Mahotsav and the G20 presidency. Ladies and gentlemen, to begin the proceedings of our first session on day 2, I have the proud privilege in inviting on stage our distinguished and eminent chairpersons, Dr. Vivek Saxena, APCCF, Government of Haryana. Let's put our hands together to welcome him. Also inviting our co-chair, Shri Yugal Joshi, Mission Director, Life, Niti Aayog. A very warm welcome to you, sir. Inviting our eminent session moderator, Professor Ashish Pandey, Department of Water Resources, Development and Management, IIT Roorkee. A very warm welcome to you, sir. We also have a very special guest with us in this session, and I have the privilege in inviting Professor Mahesh Verma, Vice Chancellor, Indraprastha University. A very warm welcome to you, sir. Also inviting our eminent panelist, Dr. Suresh Atri, Principal Scientific Officer, DEST, Government of Himachal Pradesh. Warm welcome. Inviting Professor Surya Prakash, Head DMRD, NIDM. He's not here, maybe joining us little in a while. Inviting Dr. Sangeeta M. Kasture. I'm sorry, she's not joining this session. She's here, okay. Head Energy, Environment and Forest, Decision Unit, DBT, Government of India. A very warm welcome to you, ma'am. Inviting Dr. Akash Srivastava, Additional Director and Head COH and CCH NCDC. Warm welcome to you, sir. And ladies and gentlemen, joining us on the virtual mode is Dr. Deepa Singh Bagai, Country Head, Natural Resource Defense Council. Do we have Dr. Deepa Singh Bagai on the virtual mode? Has she joined? Okay, she will be joining us eventually. So ladies and gentlemen, the session is on environment and health emergencies, critical trends. And in this session, we have with us a very special guest, Professor Mahesh Verma, Vice Chancellor, Indraprastha University. Dr. Mahesh Verma has been awarded the Padma Shri for the health and dental sciences contributions by him. He has been aiming to take dental sciences to the next level. And before we begin this session, I would request Professor Anil Gupta from NIDM to kindly do the honors of welcoming our special guest with a small token of gratitude. A very warm welcome to you, sir. We are indeed honored to have you here with us. Thank you, Dr. Gupta, for doing the honors. And ladies and gentlemen, before we go ahead with the proceedings of the session, we would like to invite Professor Mahesh Verma, Vice Chancellor, Indraprastha University, for his special address. And let's once again welcome him with a warm round of applause.
Good morning, everyone. It's such a pleasure to be here and part of this very important session. Environment and health emergencies, critical trends. I think it would be appropriate that we have the speakers starting the session, and I think in the end we can sum up whatever has been said. But as we all know that environment change is disturbing entire world today, and environment most often which is disturbed by human influences and also other global climate change which is happening. And we know that greenhouse emissions are a kind of trapping Earth, and it is leading to global warming. It is leading to changing weather patterns, disrupting usual balance of nature. It's posing a lot of risk. And also, we know that ultimately it is all linked to environmental health, which is so important today, which is a vital relationship between humans and its surroundings. And this relationship is because of many causes, pollutions, safe drinking water, infrastructural issues, all impacting human health today. And ill health is often because of its interplay of many things: environment, agent, and the host, which is a human being. And environment today is not just surrounding, it is physical, chemical, biological, anything which is external to human being, and it has a profound influence on public health. It's said that 1/4 of deaths worldwide could be prevented from if we are little concerned about the environment, because all these are environmental issues, which is mainly water, sanitation, hygiene, indoor and outdoor pollution, chemicals. All these are risk factors. And not only that, I think all these things are leading to a lot of acute events like earthquakes, floods. We are witness to what is happening in Joshimat. All those globalization, rapid industrialization, urbanization, all this is bringing in, ultimately bringing a lot of burden of disease, to the public health. And these are all critical issues. So basically, if we are, aware about it, our sustainable efforts can prevent almost 1/4 of burden of global disease because of environmental health. So this is, just an opening remark, and I think it'll be very nice that we have all the speakers speaking, and then finally we can discuss and debate about it and conclude the session. Thank you, ma'am. Thank you so much.
Thank you very much indeed, sir. Ladies and gentlemen, let's put our hands together for that wonderful address, the very insightful address we had from Professor Mahesh Verma. And may I now hand over to our session moderator, Professor Ashish Pandey. So you have about 1 hour, 15 minutes for the session. And we also welcome Dr. Deepa Singh Bagai, who's joined us virtually. A warm welcome to you, ma'am. Can you hear us? Thank you. And over to you, sir.
Thank you. Thank you. So, very good morning to all. So, as indicated, we have 75 minutes, and we have 6 speakers plus 1 special speaker. So, we have to manage our time in such a way that in first round, if our honorable distinguished panelists can finish their views in 5 minutes, then in the next round, again, they can come back, and there will be 2 more minutes to say something more. Then we can have a question round from the audience, right? Then I will request our chair and co-chair to express their views on session. And before that, I will invite Professor Verma for his special remark. So I will request one by one. So first of all, I request our distinguished panelist, Dr. Deepa Singh Bagai, Country Head, Natural Resource Defense Council, for his views. Her views, sorry. Oh. You are not audible, ma'am?
I think she's muted.
Hear you.
would you type into the chat or
Yeah,
just
I'll do
let them know that we can, until they adjust the speaking, because it's not being heard there.
Hello. Now you are audible. Please go ahead.
All right now?
Yes.
Okay. All right. So I'm sorry about this technical glitch, and this is one of those things which we, everything works fine when you're doing the trial, and as soon as you do the actual conference, something or the other goes wrong. So I'm really sorry about that. But let me just say that it is such a pleasure and honor for me to be joining. I would have much preferred to be with all of you in person, but due to certain exigencies, I can't be there. And I'm also very grateful that we are talking about this issue, because like was said just earlier, that what we are facing around us is something we can't ignore anymore. It has just become so much in your face. So the topic of this conference, Resilience and Sustainability Summit, it is so important. And India today is actually facing one of the most difficult crises of climate and health. It is extremely vulnerable, exposed to climate-linked disasters, including extreme weather events. People's health, lives, livelihoods, all are at risk. Critical infrastructure, property, energy, transportation systems, all these get affected with this. And we must all realize that when it comes to health, change in things like temperature and precipitation, they actually cause so much of change in health-related issues. Sometimes we don't even realize that, but it happens every day all around us. It was just discussed, so many diseases, waterborne diseases, airborne diseases, malnutrition. I mean, if you go out in the morning, I was out walking. Today, the air was clear. Few days back, when the air is not clear, you actually feel that there is someone pressing down on you and you cannot breathe. I mean, that kind of effect of your entire ecosystem on you, and we simply don't realize it, and we don't do very much about it, or have not done so far. So it's a very, very good time to have this discussion. There was a recent report which said that India suffered an income loss of $159 billion, 5.4% of its GDP, in the service, manufacturing, agriculture, and construction sectors due to extreme heat. I mean, that's something which we usually don't visualize, we usually don't think very much about. And it leads to the loss of potential labor days. And this increase, what is really a stunning figure, is a 39% increase from 1990 to 1999. So we are continuing to heat up our country, our places of work, our planet, and we don't have a plan B. So it is extremely important that we address this issue. Similarly, air pollution. Air pollution in Delhi has become such a big thing that every day there is a news item about it. What one would expect is that this is a given, but 1.6 million deaths annually have been attributed to air pollution exposure in India. And this number is much higher than the total recorded COVID-19 pandemic deaths. So you can imagine how severe it is and how challenging and how difficult it is. So I'd just like to point out to some of the work that NRDC, the Natural Resources Defense Council, has been doing in this area. And I'd just like to share that work just a little bit. Not so much to talk about NRDC doing wonderful things, but the important thing is that that work just needs to be pan-India and across the world. We need to just do that much more seriously, especially in heat-stressed countries. So since 2010, we had been working with the city of Gujarat, with Ahmedabad in the state of Gujarat. And a city resilience plan, a heat action plan was then developed as a pilot. And it is a wonderful thing that because of the way that heat action plan was developed and implemented, it became a part of the national disaster management plans, and heat action plans have now been developed by 100 cities, 23 states. And we have been trying to break out of a silo-based approach to solutions for climate action, air pollution, environment health, and governance, because these are all very closely interlinked. I mean, a heat action plan needs to have a very strong climate action and environmental health agenda embedded in it, but it also has to have very strong governance embedded in it to make it implementable.
Please
So
conclude within
there
2
are
minutes.
also studies which clearly show that health and air pollution co-benefits of climate action are also something which we can, really take advantage of. So those are the kind of things which we need to do quickly and efficiently. We have to remember that the poor and the marginalized are the ones who are suffering much more than us. We can wear an additional layer of woolens or put on an air conditioner, but it's those people for whom climate health emergencies are critical to their lives and livelihoods. And it is therefore very, very important that we take forward these specific interventions, and cities and states develop and implement and prioritize health and climate co-benefits and build long-term resilience. So the national governments lead, the work that NIDM is doing, the work that all of you sitting on this panel are doing, is all very critical to this agenda. I'll be happy to come back again in the second round and provide comments. But the importance of this work and the importance of all partners doing this work cannot be underestimated, and the time is now. We are already running late. Thank you.
Thank you, Dr. Deepa. Thank you. Now I request Dr. Suresh Attri, Principal Scientific Officer, Desk Government of Himachal Pradesh, for expressing his views. Please.
Thank you very much. Good morning, all. With me, all esteemed panelists, respected chair, co-chair, and moderator. I'm really delighted to be part of this deliberation today, which is very timely and, in fact, need of the hour. I come from one of the Himalayan state, Indian Himalayan state, from northwest region, and we all know entire Himalayan region is highly susceptible, vulnerable to changing climate, and there are enough evidences for that matter which are available, quite visible to all of us. Since yesterday, I'm here, and quite a lot has been deliberated, discussed. Many experiences have been shared as well. I think the journey from assessment report 1, 2, 3, 4, and 5, we are seeing, evolving, a lot of understanding about different new concepts, new semantics, which are merging about climate change, but has that really led us to, at least step forward to ensure reducing the risk enough from, climate change or not. That's a big question of the hour. And are we still trying to learn about, more experience which we are, undertaking, or based on that, we are trying to evolve still the best models for replication in future? In that dilemma, I strongly believe that, yes, we need to, put a step forward and make our society, our communities more resilient. But we must honor the practices that were in, practice in the ancient times. Our traditional way of living, the practices which sustained life till such times where we are sitting here and deliberating upon such an important issue. Building resilience and ensuring sustainability. I feel traditional practices are sustaining, and we must analyze, learn from them. You all must have heard about Shimla water crisis in 2018, when this Himalayan state, this small town, was, compared with Cape Town crisis. And, suddenly Shimla got the attention of the researchers in a list, and, the issue was, about 60 to 65% of fresh water supply was, that was dropped suddenly, and the availability from the perennial sources was a great issue there. For me, as a practitioner for the last around 35 years in this field, environment and climate change, I feel, and I analyzed, I saw growing there in Shimla, water sources, especially in urban areas, are just not depleting, but are facing the worst form of permanent loss, in fact. We are not able to revive those springs which are drying, in fact. What are we doing, in fact, is really not known. How much we are contributing to revive those spring sources. For mountain towns, particularly, the impacts of climate change very stark and substantial. Our response to that issue was not only to address the problem, but to adapt accordingly. So what we did, we created a special purpose vehicle for Shimla Jal Prabandhan, and through that special purpose vehicle, now what we have ensured that rather than acting on the ancient, the old Shimla water catchment supply scheme, to revive that scheme, to work on that scheme, we created a special purpose vehicle and lifted the water from far away from many kilometers from Shimla, from Satluj, to lift the water to the Shimla town, and then supplied and managed our, that demand and supply chain. But we really didn't work to, revive that traditional source which was there during the British time. So what the attention of the, when this problem arises, everybody rushed towards the Shimla and started talking about that. So such issues are really very important. Similarly, Shimla is an open window for dengue now. We have, as many cases of dengue, reported in Shimla, in low-lying areas of Himachal Pradesh. So those kind of crises and emergencies really need attention of, we need and we must deliberate upon that. So we'll further discuss on that. So as of now, I stop here from Himachal, right?
Thank you, Dr. Attri. Now I request Dr. R.K. Srivastava, ex-chairman, Airport Authority of India, for expressing his views. Please, sir. Oh, sorry. So now we request Professor Surya Prakash, Head GMRD and IDM, to express his views, please.
Thank you, Chair and Co-Chair. First of all, due regards to all the dignitaries, discussants, and the delegates of this program. The topic of environment and health emergencies, the critical trend, is very important, because in the current times, we are creating imbalances for our energy and economic requirements and disturbing the whole ecosystems, and also leading to emergencies. The recent COVID-19, which emerged as a pandemic, started as an endemic in one of the areas, spread across through human transmissions, and it actually gave us a warning to become aware, informed, and prepared against such risks. The biological disasters like pandemics are not the only ones which have struck as a result of these changing climatic conditions. I can recall upon several such instances, not just in the recent times, but way back in 1917 and 70, when Alkananda tragedy took place in Garhwal, Himalaya, 78 Bhagirathi flash floods. Then in the recent times, 2021, when an uncertain, untimely and unexpected event happened in the Changoli district, Joshivat block, when a major rockfall happened along with the branching of glaciate body during February, first week 2021. And also the recent event which you are now listening regarding Joshimat, the instabilities which have been induced. Now all these are because of our improper living our lifestyles with the nature, because we are not actually following what the nature prescribes to us and is always intervening and disturbing it in an adverse manner. So the nature style, I would say, being a geologist, because we have been doing paleoclimatological studies, and the records of the Earth's sediments clearly indicate these kind of trends have been in the past also. The changes in terms of temperature, precipitation, wind velocities were there in the past in the history of Earth as well as today it is happening. But the rate with which it is progressing is very much alarming, because the human intervention in terms of pollution, maybe through transportation, construction activities, and other fuel consumption activities for our energy requirements are actually inducing these disasters at a faster pace and at an abnormal rate, with places and the timing of occurrences which were not happening in the earlier times. So we need to actually have a good early warning systems for predicting these changes and also adapting to them, so that the adverse consequences can be reduced to the greatest possible extent. And I presume such sharing of this information, knowledge, innovations, technologies, and experiences with such platforms is likely to help us. As somebody has said, awareness, information, and preparedness are key to our disaster risk reduction and resilience. And communities which will awaken at the earliest possible, arise to the situations, and fight against these upcoming challenges will surely win over these disasters and become resilient against that. But those who will remain submissive, will not follow the awakening calls of the nature through such instances of disasters, will fall victim to it. किसी शायर ने कहा है कि जगाना आता है उसे कई तरीकों से, दरों पर दस्तक देने खुदा नहीं आता, पड़े रहो सहमे हुए यूं ही अगर हवाओं के पर बांधना नहीं आता. So you have to learn to tame disasters rather than getting tamed by them. Several instances can be discussed, where previous speakers have spoken about heat waves, cold wave we have seen recently, and there are many other extreme weather events which have happened in the Bay of Bengal, Arabian Sea, and various other places where climate change is more evident compared to other places. I quoted you some of the examples from the Himalayan states. So these are all actually alerts to us shared by the nature to awaken our ways of living with the nature. So this was well decided and discussed even at Sendai when it was the third conference on World Conference on Disaster Risk Reduction, where Sendai framework for DRR was declared. An ecosystem-based approach was the one which was very much endorsed by all the delegates in the conference. There were more than 6,500 delegates from more than 190 countries who participated in that third World Conference. So thank you. I'll just say that these events, incidents, and their impacts, they will continue to rise if we continue with the ill practices of disturbing the natural environments and do not learn to live in harmony with it. And that's where we have to go for it. That's why we are actually talking about adaptation, sustenance, and resilience. So these are the keys which we need to take up and reduce our energy consumptions. No, as somebody said when this Joshimath incident happened recently, that these places were actually supposed to be only temporary shelter places where people could stay for some period of time with little population. Now that population has expanded and large, and the load on these natural environments have increased because it has the capacity of say few thousands of people. Now lakhs of people are going to those places. So that is actually creating a huge degradation of that environment, and therefore more devastation and catastrophes in terms of natural disasters like flash floods, debris flows, landslides, extreme weather events, and droughts, as well as epidemics and pandemics like situations. So with these words, I thank the organizing team for providing me this opportunity to share my views, and I wish all the best for this conference and all the delegates and the dignitaries on the dais. Thank you very much and wish you all the best. So for an equitable, justifiable, that's also equally important, and with good fraternity amongst all of us. So until unless we have a justified equality, equitability, and right-based approaches, it will not help us. These kind of discrimination within the society, within the environment, will surely cause imbalances and problems in terms of disaster occurrences. So thank you very much and wish you all the best.
Thank you, Professor Shiv Prakash. Thank you. Now I request Dr. Sangeeta Kasturi, Head Energy Environment Forest Decision Unit, DBT, Government of India, to expressing her views, please.
Thank you to all the eminent members in the dais and all delegates and all the participants. Very good morning and thank you for the opportunity. I am, while these slides are loaded, I am just give background about the Department of Biotechnology, which is the funding agency for Ministry of Science and Technology. And we are looking at climate change mitigations also by supporting clean energy, promoting clean energy and innovations. Can you see the slides? It's not, slides are not. So we know that there are a lot many pollutants are there. Those are some conventional as well as the emerging pollutants. So how we can remove those things? So there are various strategies we are looking at. Those are like toxic waste from heavy metals and also the waters. The sanitation is also plays very important role in the health and climate management. The sanitation, the pathogens coming from the water bodies, waste to energy, all these initiatives, department has been promoting research and innovation. We have also supported a lot of demonstration projects. Now the science and innovation plays very important critical role, but we need to scale this in order to make this applicable and deployable. That is the important, where all these stakeholders like municipal corporation, ULBs can play very important role. The innovations which are happening, which need to be taken forward, not only at the national level, as global, national, as well as international level. There are several international platforms are available to accelerate the innovations in clean energy, like mission innovation. Similarly, we should have such things which can be done to build the resilience and sustainability capacity in the country to tackle these things. With regard to Department of Biotechnology initiatives, we are also looking at how microplastic mitigation and management can be taken. So there it's not, this is a major issue, but only what biotechnological interventions are there, those can be addressed to this. And also department is supporting now how cost-effective and alternates to single-use plastic can be developed. So government has banned the single-use plastic from the recently, so we need to have, those should be cost effective, and those various sectors, and biotech also for protected areas for forest conservation and conservation of threatened species, and all these things are being looked at. Very shortly. So these are the few examples. I'm not, in the interest of time, I'm not looking at, but these are the some of the activities we are looking at. The biodiversity conservation, how environment toxicology can be reduced, water treatment through using the constructed wetland and other, even microalgae. Microalgae also are the good components. Microalgae can capture the CO2 as well as it can capture the organic, non-organic heavy metals, pollutants, and we get from sewage water to clean water. So such these technologies can be developed and adopted, and this can be used for large scale. Coming to the environmental health strategies, we need that interdisciplinary research is very important in order to get the approaches for biological solutions for carbon neutral farming, then restoration of biodiversity and ecosystem, and systematic zero pollution to protected health. DBT recently, along with the Ministry of Environment and Forest, has also developed the risk analysis framework, which describes the principles of risk analysis used by the regulatory agencies to protect human health and safety and the environment. This is done in 2016, but we need to look at what are the futuristic risks, and accordingly the science and innovation can address these issues. Coming to the DBT is working on vector, working water and airborne environmental pathogens, and an emergence in climate change scenario, where preventive healthcare strategies to be integrated with the climate change effects and proper mitigation and understanding of the upcoming threats and future platform. So considering the recent studies and emergency recent the viral pandemics like Zika, COVID, and many others, it is important to provide for cleaner environment for human growth to reduce the occurrence of future pandemic through resilient environment. So what I mean to say in short, that science and technology plays a very important role, and we all need to identify, because many people and earlier speakers have talked about all the extreme weather conditions and climate change impacts. So we need to prepare on that, and with this, I would say that collectively we need to identify the risk and futuristic areas where these solutions can be provided. With this, I would thank the NIDM and DST for providing the opportunities. Thank you.
Thank you. Thank you. Now I request Dr. Akash Srivastav, Additional Director and Head, CUH and CCH and CDC, to express his views. Please.
Thank you. First of all, at the outset, I would like to congratulate the organizers for organizing this summit, which is very relevant to the current times. And thanks for providing me an opportunity to be here. For a very long time, when we speak about health, and the most of the experiences of you people when you visit a hospital or you talk to a doctor is about an individual approach to health. But the determinants of health, they actually lie outside an individual. They lie in a lot of environment that surrounds an individual. Maybe the science has known this for a very long time, but it is only in the recent time the evidence is emerging with scientific methods to know that the burden of the disease and the health outcomes from these environmental causes surpasses what we have known from the individual factor. So at a population level, it is very important to understand that what is this environment doing to our health and our health outcomes. And all of this has been much aggravated in the recent times when climate change is bringing a rapid, drastic change in these environmental factors. The mission on health was introduced in the Prime Minister's Council on Climate Change in the year 2015 to support the Ministry of Health and Family Welfare to work on the health mission of climate change. And in the year 2018-2019, a national program on climate change and human health was formed which has been supporting the ministry by NCDC in its implementation. It is a platform where both the center and the state governments share funds to look into concerns of climate change and its impact on health. The aim of the National Program on Climate Change and Human Health is to reduce the morbidity, the mortality, the injuries and the health vulnerabilities due to climate variability and extreme weather events. And the vision for 2047 is that we would be able to substantially reduce them with the help of evidence-based methods. There are many health outcomes of climate change, but this program has been able to address, to begin with, some of them and would gradually address all the others in a phased manner. In the current phases, it is addressing the issues of impact on health, of air pollution, of thermal impacts, both heat waves and cold waves, of extreme weather events, water, and also looking into issues of how we can have a climate resilient and a green, that is environmental friendly health infrastructure. That is, it has a less contribution of carbon emissions to the environment. All of these areas are being addressed through certain mannerisms, and the foremost is to increase the awareness in the general public so that the people can understand the concerns. At the outset, you have to understand that there are two ways to address this problem. One is to mitigate them. Several sectors which are sitting here have been working towards mitigation of this, but there is another approach, is adaptation, that is to make a human be able to withstand the impacts of these environmental changes. For that, it is important that the people understand them, and it's only when they understand them they will be able to assimilate the health messages, the do's and don'ts that we will be told about in this concern. The next step is to create the capacity of the health workforce in this country, and it's not only the existing workforce that we are working on to train them, but also trying to bring in climate change into the medical curriculum for the purpose that the doctors that are today around you did not study climate change in their medical curriculum when they were studying medicine. So it's important that the new batch of doctors understand the impacts of climate change. The next is to develop a resilient healthcare system, which means that all the states in the country have a state action plan on climate change and human health that would have chapters addressing each of the environmental concerns. Today, in all states and in all districts, we have the program reach to all parts of the country. We have a nodal officer in each state and district in the health department of the state or the district, which looks into the program, supported by an environmental cell, which is a group of people who help him out, overseeing the work by a governing body, which is chaired by the Honorable Health Minister of the state, and a multi-sectoral task force, which is chaired by the Principal Secretary or the MD and HM of the given state. We're also working towards that each disease outcomes which we have a surveillance system to address to them. Many of the diseases already have a surveillance system in the country. What is important is that the meteorological factors and the pollution-related factors are incorporated into the surveillance system. We're also introducing new surveillance systems wherever required. We have two new surveillance systems under this program, a surveillance system for air pollution-related illnesses and a surveillance system for the heat stroke and the heat deaths. We're also working towards strengthening alert system, reaching out the alerts that are generated by the meteorological department and the other departments such as Pollution Control Board to the general public, and also trying to identify alerts of human thresholds. We're also working towards climate resilient and green, environment-friendly health infrastructure. That is, they have their own independence of energy, independence of water resilience. For these are the factors that the program is working on. And thank you.
Thank you. Thank you all the distinguished panelists for completing first round. And now, in second round, I expect that we can flag out 2 to 3 important issues, and at the end, at least we can submit 5-7 issues to the organizers so that it is really helpful and a very fruitful session. So in the second round, now I request Dr. Deepa Singhal Bagai again for expressing her views in 2 to 3 minutes, please.
Thank you so much. Can you hear me now?
Yes, yes. Yes, we can hear you, please. Please try
Thank
to
you very
conclude
much.
in within 2 to 3 minutes, and it will be great if you are flagging 2-3 important issues, please.
Absolutely. Thank you. The most important issue, I think, is to take advantage of the kind of good work that is being done by, for example, Professor Srivastava was just speaking, the planning and the excellent planning that is already there in this kind of thing, the national program on climate change and health, which is already there, they are addressing these issues. Now, it is very important that we take advantage of such programs. We take advantage of what Professor Sumti was mentioning about from DBT. There is a lot of work that is already there. So one of the key recommendations that I would like to say is that the work that is being done, for example, by Professor Srivastava in the area of climate change and health, we don't treat it as the work of one agency, but we come together and support and do not work in silos and promote that work together to make sure that we are actually making a difference to the people for whom this is extremely important. The second point which I would like to make is that the research that is being done is extremely powerful and is showing us the way. Now it is for us to use that research and to devise plans not at just the national level, but at the level of implementation, at the level of small towns, cities. I mean, we talked about the Shimla example. These are the places where it has to be done in a way that the local stakeholders can come together to make that difference. And this is something which we find that there's a lot of gap between people like us who are sitting on this dais and the people who have to implement these programs. So the third point that I have to make is about the importance of capacity building and of having that kind of capacity at the local level to be able to understand and address and implement these issues. I mean, it is very difficult to say that there will be one single solution. It is also very difficult to say that that solution will be applicable to all areas. But what is important is that we have a suite of research, we have a suite of support programs, we have wonderful infrastructure already from the point of view of planning. Now to make it a reality for those who suffer every day and to make sure that the one planet that we have, we can keep it that way and keep it safe and not have tragedies like Joshimath or tragedies like, heat waves that kill people. We are able to address them in a meaningful way at the local level where we need to do that. So this is a very, very important thing, and which a big conference like this can, with all the eminent people sitting on the dais, promote in a very strong way with the organizers and with others. So congratulations to NIDM, and a big thank you to all the panelists for having given us these good ideas which we can take forward and make a real difference to the lives of people. Thank you.
Thank you. Thank you, Dr. Deepa. Now I request Dr. Atri, Principal Scientific Officer, Government of Himachal, to express his views, please.
Yes, thank you for making my point. In fact, yes, I would agree, the resource assessment and strategic planning, for improvement of demand and supply chain is the key. And that can help in reducing the risk and emergencies, in fact, related to water and health crisis. Similarly, for me, I feel strongly that, the integrated management practices must be ensured by all means for ensuring the, reduction in risk, be it from, natural hazards or man-made. Thirdly, we talked about Shimla water crisis. I also highlighted about Himachal Pradesh as a window to the malaria and the dengue in future. How do we address and what are the kind of further futuristic with these experiences? What retrofitting of, health infrastructure, or what kind of, Delhi is going for bringing water from Renuka, from Himachal Pradesh for fresh water supply to meet day-to-day that supply chain. But, if at all the Himalayan region, anything is impacted or, this carried on these climate change vagaries and, suddenly this fresh water is not available in Himachal, what will happen to Delhi? How would you, prepare yourself for that kind of emergent situations? So, a way forward towards that direction is also that we practitioners, we think tanks should also, be ready for that kind of contingent planning. So, I think we must deliberate upon and take a view to that situation as well. Thank you so much.
Thank you, Dr. Akhil. Now I request Professor Surya Prakash to express his views, please.
Thank you. Okay, friends, I'll state my concluding remarks in 10 E's. First 5 E's, I'll focus on the problematic issues that we are encountering because of changing climatic conditions and the environmental disturbances which pertain to utilization and over-exploitation of our environmental resources. First is environment that we need to take care. Second, I will talk about energy. The second is for energy consumption that we need to reduce and avoid extra utilizations. Third is economics. We are becoming too greedy. Mahatma Gandhi ji has well said that there is enough for our need but not for our greed, and we need to actually control this in terms of earning more and misusing the resources. The fourth is extreme weather events. No doubt, climate is a dynamic phenomena. It will continue to change, and change is the nature of the life. So extreme weather events we need to adopt. The fifth E is emergencies. Any emergency arising out of these changing conditions in environment, energy, economics, and the extreme weather events have to be adapted. The last 5 E's which I would like to suggest as a solution is that we have to actually try to understand the nature, assess it well, and develop an early warning for it, all kind of potential extreme weather events. Second E is this has to be actually not knowing the things, but disseminating with concerned all stakeholders. So we have to have an emergency operation centers at the local levels to disseminate this information to each and every stakeholder. That is the second E as a solution. The third is ethics. The information that we pass should be credible, reliable, and accurate, and with limitation and advantages. So ethical practices in disaster management are one of the prerequisites for getting the trust and faith of the citizens. The next is empowerment. Until and unless communities are not participating into it, they are not empowered with this information, will not succeed in our goals of disaster risk reduction and resilience. And finally, each and every entity and element within our ecosystem need to be taken care. Not only just the humans, even the plants, the zoonotic diseases, microorganisms, everything, whatever exists and is interlinked or interrelated to each other for its coexistence have to be taken care. So this is what I would suggest as my concluding remarks to this session. Thank you.
Thank you. Thank you, Dr. Shivprakash. Now I request Dr. Sangeeta for special remarks, please.
Thank you, Dr. Pandey. So four points I would just mention. So we have already talked about the climate change impacts. So first thing is we need to identify what are the futuristic risk areas with respect to the health emergencies due to climate change. The second is we need to promote the preventive healthcare systems so that we don't face again the health pandemic and this like COVID we already faced, then which are linked to climate change. The third one is capacity building. So we need to have specific whatever futuristic PhD students are there, but not only the capacity building with respect to fellowships and all, but we also need to identify the needs, whether we can accommodate them for employment and all. That part is also very important. And finally, my message would be that we all should respect nature, so that the nature would be with us. With this, I pause here. Thank you.
Thank you, Dr. Sangeeta. Now I request Dr. Akash Srivastav for his remarks, please.
So most of our speakers already spoke about collaboration. Collaboration is a very important point that needs to be taken account of. Today, we have a National Steering Committee on Environment and Health, which is co-chaired both by the Secretary Ministry of Health and Secretary Ministry of Environment, Forest and Climate Change, where representatives of various ministries come together to deliberate environment and health-related issues. But beyond policy, there is need for collaboration in many other sectors, foremost in research. We all say that all of these environmental factors are causing a health impact, but it's time that we start understanding the mitigation policies that are being formed in these countries. What is their impact on health outcomes? We talk about health co-benefits, but India needs to generate evidence on co-benefit of health by the mitigation policies that the country is taking. The next collaboration that I will talk about is about the non-governmental bodies. They are spread across the countries. They need to come forward. Even in our program, we welcome them to come and meet either at the center or the state or the district, wherever they are present, and work with our program officers to strengthen the cause. Again, the next collaboration is for the academics. They need to help teach about climate change, whether you are in the medical curriculum or you are in other subject curriculum. All students of this country need to understand what climate change is and how it will impact the country. Academicians can adopt districts wherever they are present to help the district move forward. And the last I'll say is collaboration in the area of infrastructure. Infrastructure, I'm calling out this for the health sector. We are mostly medical professionals. People who work in infrastructure should also pay attention to health infrastructure. So please come forward, talk to us, and see how you can work for the health sector infrastructure becoming climate resilient and environment friendly. Thank you.
Thank you. Thank you. Now I request Professor Mahesh Verma for his special remarks within 2 to 3 minutes.
Yeah, in fact, Dr. Ashish Pandey, if you can allow me, that in the end, I wind up, I will try to...
After chairman remarks,
okay. No, yes, I think we've had a very fruitful discussions, and in fact, if you look at all our speakers, everybody covered a very diverse and a very widespread. Dr. Deepa Bagai talked about crisis India is facing currently and how India is vulnerable, and especially it is affecting our lives, livelihood. Temperature effect, she said that the temperature effects is helping so much of our health issues because we are talking about health-related issues. Lost a lot of $950 billion have been lost because of all this. there has been a 39% increase of temperature in a decade or so between 1999, and we need to get our act together. I think that was a very profound statement. And not only that, not only locally, but pan-India, she said. And also, I think very important, she said that we need to bring in governance into the entire system, that we cannot just allow it to happen. Dr. Suresh Attri said that we know the concepts, but I think what we really need to do is to do risk reduction and building resilience and sustainability, because that must be understood. And he gave an example of, a very fine example of Shimla water crisis and how we need to revive our natural resources and innovate in this regard. Professor Surya Prakash, I think, he gave an example of a fine example of COVID, how that affected us, and improper living and lifestyles are affecting the nature, and need early warning system. I think we need to bring about that so that we can adapt for the resilience, and awakening call of nature shall be the victim. He said, tame disaster, or rather be tamed by it. So we need to tame it, not just face it, but also see how to do it. And Madam Sangeeta Kasture, I think innovation is the key, she said, and she emphasized more on a biodiversity, heavy metal, pollution prevention, risk analysis framework, and what are the futuristic risks. She will say not just what is happening now, but what could happen in future. And I think she emphasized science and technology is the key. The science will bring about research and innovation, how we can do it. And then Dr. Akash Srivastav talked about environmental factors aggravating the disease outcomes. It's all environment. That is why all this bringing about more mortality, morbidity. So we need environmental friendly health infrastructures, and so that the less carbon footprints are left. And he said there are two ways to do it. One is to mitigate the problem, and second is to adapt it, because we need to also understand that how do we adapt it and withstand the impact. And we need to include in a medical curriculum. Very important that he talked about collaboration, NGOs, universities, education, everything. And also he said that we need to have a surveillance system, need green environmental friendly infrastructure. So these were, so we have seen that we have touched very diverse issues, from especially related to mitigation and adaptation, and how do we develop resilience, in facing these environmental issues, and how environment and health-linked issues can be managed, can be adapted, and can be prevented in times to come. Thank you so much.
Thank you, Professor. I ask the opinion of chair and co-chair whether we should ask for a few questions from the audience, one or two.
Please, please.
Discuss your remarks, please. What should we do?
Yes, please.
Sir.
Yeah, I think you can take the question.
Yes. So from audience, yes, please.
Yes, I think we have Madam here. Madam?
Yeah.
Can we have a roving mic here, please?
No, they have the mic.
Achha, they have mic, sorry.
Okay.
I think I can speak loudly. Am I audible?
Yes, you are.
Yeah, I'm Archana Sarkar from the National Institute of Hydrology in Roorkee. My question is one of the panelists emphasized on limited developmental activities in high mountain ecosystems. So in your opinion, my question is, what could be the reason of this, present Joshimath crisis? Is it because of the increased overburden due to increasing population and increased construction activities? Or is it because of the construction of the hydropower projects and the road widening? Because there's a big debate going on. There is a group which blames the hydropower sector and the road widening activities. The other group blames the overburden in construction. There was a report, a Mishra report in 1970, which said that this area is a landslide-prone area. So what could be the reason? And further, what is the solution from the policy makers and the government side? Such crisis, we are living on the edge, and there are many crises, already there which would happen, like the Joshimath case. There have been the reasons and the solutions.
Should I respond? Yeah. Am I audible?
Yes, sir.
Yeah. So basically you have answered yourself that you know that whenever there is such type of crisis or something occurs, some sort of a disaster which occurs, then certainly it captures your attention and the media attention also. But the thing is, over the period of the time, we all talk of the sustainable development. We all know all those things. But the pattern of development which we do, each and every one of us, somewhere to be, you can say, need to be part of that blame, rather than blaming that there was some report and then action was taken or not taken. So once the disaster happens, the only thing is, rather than having the blame game, okay, you can always learn from your mistakes, but for future, what you are going to do. That is the key, that if we give this message that, okay, whatever has happened, but learn from your past mistakes, and for future be ready and prepare, that how to minimize the impact of such a sort of a natural disasters. Because some natural disasters which happen, they are you can say, the products of the nature. But at the same time, some of the man-made or induced these sort of disasters, which especially are based on the today's topic, when we are talking of the environmental health emergencies, they trigger a lot of simultaneously environmental health issues also. So I think you yourself has answered whatever has been your query.
Okay, so one point I will add. So, if this is an issue of concern, so can we have a strong recommendation from the panelists in this direction?
What exact recommendation you want?
To the policy makers, recommendation for the policy maker. I mean, we can, as experts, we can recommend that whatever is the research, it should be implemented. It should be taken seriously by the policy makers and the government.
I feel that there will be a separate session for that, because this session is basically for environmental health.
Yeah.
Yeah, so that will be discussed in another session. Yes.
But the fact of the matter is, yes, there is an environmental emergency in Joshimath, and it is not, it cannot be accorded focused or pinpointed region for that. It's a multiple causes behind it, and we must not interfere much with environment. So that's what the message panelists would like to give.
We have a gentleman this side.
Last question.
Sir, I am Krishna Kumar from Rashtriya Seva Bharati, and our members and affiliates, they are available all in Pan-India, and they are the first responder during any disaster. Wherever a disaster occurs, our members go there and respond to that. So when we talk about resilience to health issues, it comes to my mind the loss of lives due to shortage of blood during a mass casualty situation, be it an accident or cases of MMR during cesarean operations, or people suffering due to renal dysfunctions, thalassemia, cancers, etc. occurs. We can very well develop a system when we can locate live blood balloons. I mean about the highly motivated youth during and ready to donate blood available around that place. Whether the Department of Science and Technology, NDMA, SDMA, even the city disaster management authorities would prefer to get such system developed and deployed as soon as possible. Thank you.
Hello. Yeah, I think this is one of your recommendation, which I think they will take note of it, because this relates our present discussion on the panelists, which we have discussed. Basically, it relates to the environmental health emergencies related and future pathway. When we talk of the pathway, certainly this can be one of the recommendations which can be incorporated.
Thank you, sir.
I think in the interest of the time, you can take one more question.
Just one observation, one question, if I am allowed.
Yes,
Yes.
please be quick.
This is Professor Shamim from University of Kashmir, Srinagar. Just one observation that I wish that every session have some recommendations. Since yesterday also, so every session, whether this session for health and environment as such, so we should have a concrete recommendation that should formulate the final outcome of the conference. That's one thing. Another, I think we should not wait for the disaster as such. We should address the hazard first, because every hazard then ultimately leads to the disaster. So there are n number of hazards which are incoming and going in terms of the health and environment. I just put one example in case of Kashmir specifically, that over a period of time, because of huge use of insecticides and fungicides in the horticulture sector, I think in Himachal will be the same issue as such. There's a huge amount of issues in terms of the carcinogenic disease which is emerging there, especially in the districts where we have a huge amount of footprint of the this horticulture, which earlier used to be a different type of agricultural activity. And it's very alarming. And you'll be really surprised if the figures are coming out, how the pattern of disease has emerged there. I think there needs to be the interventions on that front from the, I think, biotechnology department and other departments to figure out the things that we can address this hazard at this point of time, rather than it becoming a disaster afterwards. Thank you so much.
Thank you. Now I request all the participants to please discuss with our esteemed panelists during tea time or lunch time, please. So now it's time for chair and co-chair. So first of all, I request Sri Yugal Joshi to express his views and remarks. Sir, please conclude your views in 5 minutes. 5 minutes, so that we can give 10 minutes for chair, at least. Yeah.
Very nicely moderated.
Good morning. As I understand that most of us here are either scientists or engineers. The kind of discussion, very fruitful, very forward-looking, micro kind of analysis. I liked it very much and learned a lot from this. But I want to take you back to history. We human beings have this tendency to be very, very arrogant. As all of us know that our sun is 4.6 billion years old, Earth is 4.5 billion years old, and we Homo sapiens are just 3 lakh years old, 300,000. Before us, there were many, like dinosaurs, who don't exist now. Even we came after, there were other homos, Homo Neanderthals and others. It is not that we are here for forever. Like these discussions, all these things which I, sometimes I feel like once in Mahabharata a story comes, Yaksha asks Yudhishthir, what is the, biggest surprise in this world? So Yudhishthir replies that people daily see people dying and still they don't realize that one day they have to die. They think that they are here forever. Professor Saab talked about Gandhiji's thing that earth is enough for everyone's need but not for everyone's greed. Madam also talked about we should care for the nature, we should care for the earth. These two things I think are very prominent. When we talk about our ancient civilization, in Ishopanishad, people say that we are here only the trustees of this world, and it is our duty, whatever we are receiving today, that we have to either it better or we should give it in such similar form to our next generations. And how much time it took us to understand this. Today in 2023, when we are discussing all these things, in Upanishad, people understood it, how important it is to understand that we are not the owner or maliks of this earth. Whenever we are talking these things, whenever we are planning about these climate resilience, health and other things, we are only talking about Homo sapiens. We are not talking about global, we are one of the many species here around. So, when Gandhi talked about need and greed, when Ishopanishad talked about trusteeship, in 1987, almost after 15 years of that Stockholm summit, Bartlett report comes where they say that, what is our common future. They talk about what we should do so that our next generation can also fulfill their needs. They also talk not about greeds but needs. And when, after so many years, even after 1987, we had so many protocols, Rio de Janeiro summit, we had Earth summit, Kyoto protocols, Paris protocols, all these things. And finally today, I think first time in COP26, Prime Minister first time talked about lifestyle for environment. This, we have been seeing how it is very difficult to pinpoint one developed country or developing country. There are different kind of blocks. There is no common element that how they are going to lead these humanities or the world in future. So finally, it pinpoints, everything depends on us individuals, human beings, what kind of earth we want in future, what kind of responsibilities we want to take. That's why when there was a UNEP study, United Nations Environmental Programs study, that if 1/8 of this global population can behave in certain kind of environmentally conscious way style, then these carbon emissions can be reduced by 20%. So that was used. And mind you, 1/8 is, less than India's population. We are 1.4 billion people here. So if the target was that if we Indians, first thing is that we have to understand what are the repercussions. We are, as I said, only 3 lakh years old, and as Stephen Hawking before his death, some kind of, he has this warning for us that we are here only till 2042. Yuval Harari has said so many, things that how long we are, Homo sapiens are to survive here. So I think now it's the responsibility of each and every individual. As Prime Minister says that if we start behaving in certain environmentally conscious ways type, we follow, not the mindless consumption, but mindful utilization of things, then only we can save this planet. And mind you, there has been awareness. People have now started living. The duty of people like us who know these things, who have certain awareness about these things. Now it is time that we should start behaving in that fashion. We should lead by example. Normally we say that IEC activities are very important. Behavior change are very important. But if we can learn anything from history, is that, we should not be ignorant to these facts, that let us, take it to a mass moment. Let us tell each and every people how this is very important and how this is the important time. This is the day, this climate clock is ticking. We know, we have failed. This 1.5 degrees Celsius, these all targets are now, we don't know that the temperature we can contain to this thing. So it's our responsibility, each and everybody's responsibility to start behaving in that, environmentally conscious way, a lifestyle that suits, that is sustainable. SDGs, COVID, everybody, talks so many things. We are lagging behind. We have to see that by 2030, how we are going to achieve these all goals. There are shared or differentiated responsibility, but ultimately it boils down to individuals. So my request will be, all here we have our sphere of influence. We know, to whom we can influence. So let us spread this message that now this is not the responsibilities of the governments. It is now responsibility of each of us to, behave in that certain fashion which is sustainable, which, so that our species, at least Homo sapiens, can survive longer. Thank you very much. Thank you very much for listening me patiently.
Thank you. Thank you, Mr. Joshi. Now I request Dr. Vivek Saxena, APCCF Government of Haryana, for chairman remarks. Please.
Thank you very much. At the outset, let me congratulate all the panelists for highlighting very, very important aspects on the topic which we are deliberating, then environmental health emergencies, what are the critical trends and what should be the pathways. As we know, the present decade, especially from the beginning of 2022, it has been devastating year for the global health. Maybe the foremost thing which comes to our mind, that is the pandemic crisis related to the COVID, and which is also somehow related to, you can say, the environmental health issues, because as the co-chair Mr. Joshi highlighted, that whatever things we think, they are all human-centric, and on this planet Earth, it is not the human species for which this planet Earth has been designed. There have been a number of other species, they have become extinct, and he also gave a warning that for as a human beings, we should not think that we are here forever. And now since we have been bestowed with the capabilities of innovations and many other things, but somehow with these innovations, we have, you can say, created a disharmony with the nature, because on this planet Earth, there are a number of species, some of which the role, their importance which we know, and some of which we don't know. But each and every species of the ecosystems across the globe on this planet Earth, they have a very critical and important role. Just for example, the bees, the honeybees, they are so much important in, you can say, sustaining our food systems. But in our development pathways, we are not giving that much importance, and we are not realizing what sort of if our food system, food production systems are disturbed, then in what way in the future we are going to have, what type of other crises can happen. Now coming further, now as we are talking about the environmental health related emergencies, so the root cause, like we talked about the air pollution, the statistics was given that because of the air pollution, how much of the GDP we lose. Similarly, the water pollution, similarly the waste management issues, the chemicals which we use, the oil spills, they are all, you can say, they undermine our decades of, you can say, progress, and somehow the productivity is also getting affected. When we talk at the, you can say, in the terminology of related to the climate change, certainly because of anthropogenic activities, the climate change is reality, and because of which many of the things which are happening, and because of this environment related challenges are there, we have to invest more and more in tackling those issues. Biodiversity loss, the species loss, species extinction, that is creating different type of, that has a health emergencies, and that has also a potential. Similarly, in terms of the land degradation, the soil and nutrient loss because of the unsustainable our cultivating practices, that is also related to the environmental health issues. Because whatever we talked, we basically talked related to the climate change and whatever are the present schemes and whatever are the things. But what are the root causes of these environmental health emergencies, which we need to incorporate? And the Mission Life, which Prime Minister launched last year on 20th of October, along with the UN Secretary General, that is one of the key in which each and every one of us, they adopt the lifestyles that take care of your, you can say, consumption, that is the need based, not the, you can say, unmindful consumption, which Mr. Joshi also highlighted. That is very much important in that if we, in future we want to, you can say, minimize the environmental health related emergencies. So the preparedness, prevention, responsiveness, they are some part of the overall, you can say, strategy when we talk of the disaster management. And especially one of the important aspects which was also highlighted, the environmental health related emergencies, because of the various, you can say, use of chemicals and non-treatment of the wastewater discharge and all, the carcinogenic effects that is creating, you can say, in the entire environment also, and that in the long run it affects the entire community. I think one of the very important aspect, one of the panelists highlighted, that when we see the environment related, you can say, when we link it with the links with the environment, we see the patients in the hospitals and in the doctors, somehow we say because of the season, because of the air pollution, breathing problems and all. Then again the approach is the individualistic. That is, rather than if we see that if we want to take care, we have to ensure that the air we breathe, the surroundings of us, that we ensure that through our, you can say, sustainable lifestyles, maybe in terms of the transport sector, maybe in terms of the other construction waste, because of which there are a lot of environmental health issues related to the lungs they cause. But if we ensure that the surrounding air, for which each and everyone is responsible, that is good enough so that we breathe a fresh air, so certainly these are challenges, you can say, the number of patients they become less, and we will be breathing more and more clear air. Similarly, when we talk of the water requirement, because the water we drink, if we get a safe drinking water, so certainly it will improve our health, and it will also minimize the harm which we are witnessing. So these are the basic things which we all know already, but when it comes to the practice, it comes to the day-to-day actions, that is the need of the hour, so that we have to ensure that the air which we breathe, it needs to be clean. The water which we drink, it needs to be cleaner. Because if we see, when we were young, in our childhood, we used to drink any type of water from any of the tap. But the now present generation that has become so vulnerable to this type of water, even we ourselves now prefer that RO water and mineral water bottle only. So we have to think that how at the larger scale, one of the very good example which Dr. Atri gave, that in the Himalayan ecosystem or the mountain ecosystem, where the linkages, you can say upstream and downstream linkages are very, very important. And if we don't sustain our ecosystem services provided by the mountains or the Himalayan ecosystem, and these downstream linkages, they are adversely affected. So entire, you can say, the food value chain and other type of ecosystem services value chain that get adversely affected. One of the good example which he gave, the revival of the springs, which is certainly the need of the hour. So these are some of the important points, I think, which panelists in their presentations or in their discussion they highlighted. And with these words, I once again thanks to the organizers for organizing this summit on a very, very relevant theme, sensitizing and especially on this topic on environmental health emergencies. And I hope the deliberations and suggestions will be key to the, you can say, as a policy inputs for future action. Thank you very much.
Yeah. Thank you, Chair and Co-Chair, for insightful remarks. Now request the organizers to please take up the agenda, please. Thank you.
Thank you very much indeed. Ladies and gentlemen, let's put our hands together for that wonderful session we had. मंच पर उपस्थित सभी वरिष्ठ गणमान्य अधिकारीगण का तहे दिल से हार्दिक धन्यवाद करना चाहेंगे और अब निवेदन करना चाहेंगे मिस्टर सरबजीत सिंह से, ये हैं इमरजेंसी एनालिस्ट यूनिसेफ से, कि वे एक स्मृति चिन्ह भेंट कर सम्मान करें. We present to our session chairs Dr. Vivek Saxena, APCCF, Government of Haryana. We present to Shri Yugal Joshi. Thank you, Mr. Sahota, for doing the honors. Thank you very much indeed. I would now like to invite Ms. Richa Srivastav, Consultant NIDM, to present a token of gratitude to our distinguished session moderator, Professor Ashish Pandey. हार्दिक धन्यवाद करना चाहेंगे आशीष पांडे जी का सेशन को मॉडरेट करने के लिए. I would request Ms. Richa to also present to our eminent panelist, Dr. Suresh Atri. And to Professor Surya Prakash. Thank you very much indeed, Ms. Richa, for doing the honors. May I now invite Ms. Pritha from NIDM to present to Dr. Sangeeta M. Kasture. And to Dr. Akash Srivastava. And now for the group photograph, may I also invite Mr. Sahota, Ms. Richa and Ms. Pritha to join the panel for a group photograph. And once again thanking the eminent panel here on the stage. We will now break for tea. The tea is served on the ground floor in the atrium. You all are requested to join us on the ground floor for the high tea. Ladies and gentlemen, the next session will commence at 11:30 sharp. We would request you all to be back in time for the next session. And I also take this opportunity to remind each one of you about the Parisamvad sessions which are being held on the first floor. We also have a selfie point there along with the exhibition. You can go there, please visit the exhibition, take your selfie, with the background of Re-Summit 2047. And you can tag yourselves on the social media with that selfie of the background Re-Summit 2047. And with that, we now take a break. Tea is served once again on the ground floor at the atrium. Thank you.
Recording stopped.